People who develop PTSD will have a combination of biological, psychological, and social factors that increase the vulnerability to PTSD. Biological factors include several neurotransmitter systems that seem to be affected by trauma. These systems include the non-adrenergic system, the serotonin system, and the dopaminergic system, and the beta endorphin system. We may speculate that a person with developmental disabilities could be more vulnerable to higher levels of distortion of such systems after trauma. Psychological factors include lower intelligence, being female, and negative self-esteem. Social factors include lower education, exposure to prior trauma, and lack of social support. So my teaching tool is BSP. B stands for biological factors, and S stands for social factors, and P stands for psychological factors.
There are 3 symptoms of PTSD, and you can remember them by the word area. The first A stands for avoidance of trauma reminders. These people stay away from anything that might trigger them, and this can result in becoming withdrawn. The RE stands for re-experiencing the trauma. They experience flashbacks and nightmares. They feel the same pain and terror as when it actually occurred, and this can take form in engaging in high-risk behavior. The last A stands for increased arousal. They have extreme awareness of the environment, and it can result in an increased rate of substance abuse.
People with developmental disabilities have similar symptoms as people without. These symptoms are behavior indicating, self-mutilation, aggression, non-compliance, and inappropriate sexual activities. People with developmental disabilities are usually misdiagnosed as schizophrenia if they are nonverbal.
Describing treatment, the term healing is used. The person undergoes psychotic wounds that can be healed with appropriate interventions. My teaching tool is TECD. T stands for therapeutic interventions, which is highly recommended. Successfully utilized with psychotherapy from the dual diagnostic. The E stands for exposure therapy. Quite successful also, given homework to confront stimuli outside, beginning with low risk. The C stands for CBT. This helps understand that they were a victim and reassessed control over their own safety. D stands for drug treatment. There is no consistent type of medication that is successful with PTSD, but you can take medication that helps with your anxiety, depression, and hyperarousal.
People with developmental disability have 3 more steps of treatment than people without any developmental disabilities. These steps are: first, identify any outstanding medical problems and treat them. Then minimize any iatrogenic compounds, which is removal of triggers, such as if someone was sexually abused, just communicating with them that you're going to touch them, where you're going to touch them, and do not touch them abruptly or unknown, and then educate supporting staff.
There are 2 main supports you should use when supporting someone with PTSD. The first is to anchor them in the here and now during a flashback. You can do this by reminding them where they are and always reassuring that they are safe and no one will hurt them in the environment. One of the most important things to do is to stay with them and confirm their presence, and to always use a gentle touch and be reassuring. The second is to remove triggers from the environment. So you want to remove anything that could possibly trigger someone to have a flashback. These can be things like pictures, even removing certain people, as well as sounds such as alarm clocks and fireworks. Settings and routines may seem abnormal for a little while because of ordinary things being removed from the environment. My teaching tool is the word ART. The A stands for anchor in the here and now, and the RT stands for removal of triggers.